Hello, peeps, and welcome to another episode of Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter, your board-certified internal medicine physician, your primary care extraordinaire, and welcome back to the Prescription for Better Living podcast, where our goal is to discuss all things health and wellness in a hip and relatable way. We want to promote health equity. We want to decrease healthcare disparities and increase your health literacy. So if this is your first time or if you've been rocking with us the whole time, here's what I need you to do. I need you to subscribe to the YouTube channel, Prescription for Better Living. I need you to like the videos. I need you to comment on the videos. And I need you to share the videos. I need you to spread the gospel, the good news of the Prescription for Better Living podcast. Shout it from the mountaintops. Hallelujah, Dr. Carter is here. So, if you've been on this journey with us, you know what we have been talking about. If you haven't, that's okay. All of the previous episodes are right there on the channel for you to go back and watch them at your leisure. But as you know, we've been spending a lot of time talking about things that are a bit off of the beaten path, if you would, when you talk about just hearing a healthcare professional or medical doctor talk to people in the community. We typically would talk about high blood pressure, which is very important, diabetes, very important, breast cancer, extremely important, prostate cancer, extremely important, all of your health screenings, etc. And we are going to get into that for sure. We release one episode per week. There are 52 weeks in a year. And so we have over 40 more opportunities to cover those things. But here's what I'm attempting to do, y'all. I am attempting to illuminate some of those topics that are equally as important as high blood pressure, diabetes, your cancer screenings, but they don't get discussed very much. Well, why am I doing that? And again, we're talking about the mind-body connection, and all I'm really talking about when I talk about the mind-body connection is I'm talking about the universality of health, right? Health is something that is very interconnected. We talk about it like all these different aspects of health exist in silos. We talk about high blood pressure, like high blood pressure is not connected to stress. We talk about obesity, like obesity is not connected to sleep. And so when you talk about these things in silos, here's what happens. You hear one topic and you say, well, that doesn't pertain to me. And then you don't focus on it or you don't pay attention to it, right? For example, if you are a naturally thin person and I just so happen to be talking about obesity, you may tune out because you say, well, obesity is not pertinent to me because I've been skinny my whole life. I can eat whatever I want. I can eat 2 Big Macs. I can eat a whole pizza. I can eat a rack of ribs, and I will not gain weight because I have a high metabolism. Well, that may be true. But when we talk about obesity, what we're really talking about is lifestyle. And I don't care whether you're thin or whether you're thick. If you have a unhealthy lifestyle, then you are unhealthy, right? You can be skinny and still have high blood sugar, believe it or not. I know a lot of heavier people who are not diabetic. And I have patients who are as thin as my pinky and they're diabetic. You can be very thin, but have through the roof, sky high cholesterol, right? And then I know people who you would assume would have high cholesterol by looking at them, but they have normal cholesterol. So this is what I'm talking about when I talk about the homogeneous nature of our health, right? Everything is connected. And so when I talk about the mind body connection, I'm really talking about the total person health connection. So we've been talking a lot about mental well being. We've been talking a lot about depression, anxiety, etc. We've even talked about grief and the negative impacts that grief can have on you. And remember, when I use the term grief, I'm not speaking in a clinical sense, because in a clinical medical sense, there is a such thing that's known as a grief response, a grief reaction that usually lasts about less than 2 months or so. But remember, when I'm talking about grief, I'm not talking in the clinical medical sense. I'm talking in the spiritual sense. And we said that grief is a spirit and it is infinite. It doesn't have a beginning or an end. We said mourning is a finite period of time, that it has a beginning and it has an end. But grief, if you let the spirit of grief rest on you, and if you just lay in it, it will just let you lay there until it kills you, until you die. So we talked about all that on previous episodes. And then we asked a question, and here's where we're going to go a little deeper, because I realized after I asked this question that I really owe you a little bit more on this topic, and it's the topic of sleep. And I asked you, how much sleep do you need? I didn't ask you how much sleep you think you need. Because some people say, oh, I'm, 4 hours, 5 hours, and I'm ready to rock. That ain't what I asked you. I said, how much sleep do you as an adult need? And the answer is you need 7 or more hours of sleep each night. Why, Doc, do I need 7 or more hours of sleep each night? I'm glad you asked. Because our bodies need time to recover, right? So there's something that happens in sleep that allows you first, again, to have a recovery from all of the physical and mental stressors of the day. But also your body needs sleep so that it can heal itself, so that you can lay down your memories. People who are sleep deprived often have complaints of memory loss, being more forgetful, being foggy, or having clouded thinking. So that's why sleep and adequate sleep is appropriate. You need deep sleep. You need what's called a REM sleep, where you do need to dream. You need a restful, good night's sleep most nights of the week. Now, I'm all about transparency. And so I have another confession to make. On most nights, I do not get 7 or more hours of sleep. That's right. Now, you say, well, this the doctor telling me what to do, and he's not doing it. Is this a case of do as I say and not as I do? Absolutely it is. It absolutely is. I know the right thing to do, and I'm trying to communicate it to you. And I start the day off every day with the goal of getting 7 or more hours of sleep. But sometimes I can be a little unbalanced. Sometimes I can be a workaholic. If you have not Googled me or checked my resume, you should do so, not out of being boastful, but so that you can understand why I say I can be a bit of a workaholic and I can be a little bit out of balance, because I do a lot. And a lot of people ask me, how do you do all that? And the honest truth is that to do as much as I do, something or someone's are going to suffer. I do not allow my patients to suffer because of how busy I am. because that would not be fair to them. I do not allow my family to suffer because of how busy I am, because that would not be fair to them. So, who draws the short straw? Oh, Hernando draws the short straw. So I make sure that I prioritize those things that are important, like spending time with my family, taking my children to school, picking them up, being at their practices, being at the games, having dinner with them. And once I have left my 8 to 5, or sometimes it's not 8 to 5, sometimes it's my 7 to 11 job. But whatever hours I'm working, I make sure that I'm giving time to my family. I'm making sure I'm giving time to my patients. And so, Hernando has a problem of being out of balance and being a workaholic. And no, that is not the right thing to do. That's certainly not God's will for my life. And I'm working on that. Hello, my name is Hernando, and I am a workaholic. I have a friend, an assistant now who's helping me, and she introduced this concept of something called black time, where it's, I look at my calendar, and if I have open space on my calendar where I don't have anything scheduled to do, I say, oh, there's empty space, I need to fill it. Or there's empty space, I got this project I'm working on, now it's time to do it. Or if you call me and you say, can you do ABC or XYZ? And if I see empty space on my calendar, boom, I plug in and say, of course. But that's not the healthy thing to do. So my name's Hernando, and I'm a workaholic. Hey, Hernando, I'm working on that. But yes, even I need 7 or more hours of sleep. And I tell you what, when I get 7 or more hours of sleep, you know what? The next day, my mind is clear. I perform better. I'm sharper. And the day is easier. So that's proof positive that even I need 7 or more hours of sleep. I tell you who can get their sleep. Dr. Adrian Carter I am jealous of how Dr. Adrian Carter could go to sleep right now in this chair with all these lights shining on her. If she set her mind to it, she could do it. And she's my hero. That's where I want to go. So you need 7 or more hours of sleep. But some of you are not workaholics like me. That's not your problem. Because if I laid in the bed with the intention to go to sleep, I could go to sleep. I could stay asleep. And I would wake up in the morning refreshed. I have a little help with that, and we'll get into that in a couple of minutes. But some of you lay down in plenty of time to get 8 or more hours of sleep. But you lay there for hours, 1, 2, 3 hours before you fall asleep. Some of you can lay down and fall asleep, no problem. But after just a few hours, boop, you're right back up. And you can't fall back asleep. And then there are some of you who can lay down, fall asleep, can sleep through the night, but you wake up and you feel like you only slept 2 hours and you've slept 7 or 8 or 9 hours, and you fall asleep during the day. You fall asleep in the meetings. You could fall asleep standing up. You certainly can't go to the movie theaters and let them turn the lights down and you make it through the entire movie. No, you fall asleep. So let's get into some of that. What I'm talking about is insomnia and sleep apnea. Now, some people have insomnia because they are sabotaging themselves, and that's most of you who have insomnia. How am I sabotaging myself, doctor? I'm glad you asked. You are sabotaging yourself because you have poor sleep hygiene. Yep. There's a such thing as sleep hygiene. You thought hygiene was just brushing your teeth and flossing and taking a bath every day and putting on deodorant, I hope. That's hygiene. That's important for sure. But I'm talking about sleep hygiene. There are rules as relates to having good sleep. We call it hygiene. And if you don't follow these rules, if you deviate from them, this could be why you're having a hard time falling asleep. Well, what are some of those rules? I'll give you one. Caffeine too close to bedtime. And now you got to be careful because when I say caffeine, of course I'm talking about coffee. Yep. Well, how about tea? Now, I'm in Alabama, Birmingham, Alabama, Roll Tide, and we love our Milo's tea. They make it. You can get sweet tea. You can even get it extra sweet. I think it comes in it's got a purple label. You can get the Splenda tea. It's got the yellow label. The regular is the red label. You can even get the unsweetened. I think that's the green label. I know my Milo's teas. But did you know that iced tea has caffeine? If you drink tea with dinner and you're having problems going to sleep, maybe that's it. Soda, of course, Coke, Pepsi, Diet Coke, Dr. Pepper, Lord have mercy, Mountain Dew, Mellow Yellow, caffeine, okay? But there is also caffeine in other things that you may not think about. Do you like chocolate? What's your favorite chocolate? You like Snickers, Twix? What is it? Did you know that chocolate has caffeine in it? And that can be keeping you up? Yeah, absolutely. Too much sugar close to bedtime. Wake you up, can keep you up. Well, what else? Lord have mercy. The phone. Do you lay in bed and scroll through your phone? Do you go and catch up on your socials, IG, Facebook, TikTok, Threads, Snapchat? Do you do that? There's this little light that is shining from your phone, and that light is stimulating your brain. It's going to the gland in your brain that wakes you up. And that light is telling your brain, it's not sleepy time, it's wakey time. Phones. What else? Alcohol. Alcohol too close to bedtime can make it harder for you to fall asleep or to stay asleep. Alcohol could be the culprit. Exercising too close to bedtime. No, this is not your excuse to not exercise. But some people, if they exercise too close to bedtime, that makes it more difficult for them to fall asleep or to stay asleep. What else? Maybe you do too much in the bed. You know, you eat dinner in the bed, you watch TV in the bed, you scroll on the phone in the bed, you get work done on your laptop in the bed. And so your brain has not equated the bed with sleep. Your brain is all confused. You're saying, what are we doing? Are we working? Are we going to bed? So sometimes I tell my insomniac patients that the bed is for two things. Two S's. Sleep and sex. That's it. You get into bed, you need to be getting ready to lay it down or lay somebody down. Married only, please. Thank you. Now, but the two S's, sleep, sex. So maybe you're doing too much in the bed. Well, what do I do about it, Doc? I'm glad you asked. I'm not asking you to make drastic changes, but think about, because typically there's something that you do on most nights, right? That could be contributing to these problems. If you like to have a soda with dinner every night, or if you like iced tea with dinner, or you got to have your coffee or whatever, cigarette after dinner. Cigarettes will keep you up, by the way, and raise your blood pressure, which keeps you up. Maybe we need to adjust the time that we are eating, or adjust the time that we're going to have that tea or that chocolate, right? So maybe if you eat dinner at 8 or 9 o'clock, you shouldn't even expect to be able to go to sleep by 10 or 10:30. So maybe we need to eat a little earlier, right? If you like to check your socials and do all that stuff before you go to bed, don't lay in the bed and do it. Sit up in the living room, at the kitchen table, just somewhere other than your bed, and do it. But when you get ready to lay down and you go into that dark room, turn that phone off. I saw they have on, I saw it on Instagram. There was an ad for this device that you can put your phone in to block out the light. You remember when Dave Chappelle came to Birmingham and they took everybody's phone? I thought that was whack, by the way. Why you take my phone? I'm a doctor. People got to call me. Can't we be on the honor system? But anyway, but they have devices like that you can drop. It's like a blackout bag or something that you can drop your phone in. And that way, if you have a fellow insomniac that wants to DM you or text you in the middle of the night, you don't hear that phone bzz, bzz, and see that light flash, and then it stimulates you, and then you are up. Another helpful thing that you can do, let's say you don't have a problem falling asleep, but you have a problem staying asleep. Okay, you have to retrain your body. So you're up, you're laying there, and typically, if you wake up in the middle of the night, if you've not fallen back asleep within 10 minutes, you're probably going to have a hard time. So what you want to do is you want to get up out of the bed and go in the other room. Don't get your phone, please. Maybe get a book or a magazine or something and read or peruse until you feel sleepy again. Once you feel sleepy again, you make your way back to the bed and to the bedroom, and you try to go back to sleep. And you repeat that cycle again and again, because what you're doing is you're retraining your body and your brain that the bed is for sleep and for sex, and that's it. So you're either going to get very sleepy when you go to your bedroom, or you're going to feel some other kind of way. And then that'll probably help you feel sleepy later on too. So that's a little bit about insomnia. Now, I want to introduce a topic to you, and most of you have heard about it, especially because of the news media. But it's very underdiagnosed still, and that's called sleep apnea. Sleep apnea. What is sleep apnea? I'm glad you asked. While we are sleeping, we all may have pauses in our breathing, right? But just a few every hour. Well, someone with sleep apnea has a very high number of times that they stop breathing every hour. Another sign of sleep apnea could be loud snoring. You ever slept in a room with someone who snores very loudly? And I mean, it just keeps you up. It vibrates your skin. They snore so loudly. But then you get these heavenly pauses where they quiet down and you don't hear the snoring any longer. And then you hear just this, monstrous roar, and the snoring's back. Well, that heavenly pause and silence is not them quieting down. That's a very dangerous thing. That's them no longer breathing. They've stopped breathing. And that loud roaring gasp you hear when they start back breathing is their brainstem telling them, fool, you finna die. Breathe. And then they gasp for life to come back into them. That's sleep apnea. Contrary to popular belief, you don't have to be heavy to have sleep apnea. Now, there are some physical characteristics that make you more predisposed to sleep apnea. A thick neck. See this neck here? It used to be a 18 and a half. I got it down to a 17 and a half now. But that's a large neck size is a risk factor for sleep apnea. Your anatomy, and you can't do anything about your anatomy, but how narrow is the airway going from your mouth down into your throat? You have your palate, and then you have your tongue. And if you have a thicker tongue, if you have a lower palate, then that's going to make the airway more narrow, and that increases your risk of sleep apnea. You ever had surgery, and before your surgery, the anesthesia doctor comes in and asks you to open wide? Well, they're looking for your Mallampati score, and that is how narrow the opening to your airway is. And that tells them how difficult it's going to be to put the breathing tube down, and how difficult it's going to be for you to breathe once they take the breathing tube out. Well, all that puts you at risk for sleep apnea. And I'm talking about obstructive sleep apnea, but there are some skinny folk who have it too. So loud snoring, waking up in the middle of the night frequently, waking up with your heart racing, feeling like you've been running a race. I often ask my patients, and it's a trick question, when I'm trying to screen them for sleep apnea, is I say, do you snore? And they say no. I say, well, how do you know? You were asleep. But their spouse or a friend can tell me if they snore. Now, does everyone who snore have sleep apnea? No, they don't. I've been very surprised by some of my patients that I've referred to get tested for sleep apnea. I just knew they had it because I've heard recordings of their snoring, and they didn't have sleep apnea. Because remember, sleep apnea is the number of times per hour that you stop breathing. If you stop breathing less than 5 times per hour, you don't have sleep apnea. If you're 5 or more, you do. And the more times you stop breathing per hour, the more severe sleep apnea. Transparency moment. Many years ago, I was having trouble sleeping. I was waking up with my heart racing, sweating, thought I was having a panic attack, or I didn't know what was going on. My heart was fluttering. And I went to see a cardiologist, and the cardiologist did I had all kind of tests done on my heart. I wore a heart monitor for a month, had a stress test, had an echo, I had a heart cath, and it was normal. And then the cardiologist said, we should test you for sleep apnea. Okay, I thought was reasonable, because I do remember that sometime after college in medical school, I started having a very hard time staying awake during the day. And I mean, like standing up during rounds, falling asleep. Well, I thought I was sleep deprived, because when you're in medical school and you're in residency, you work 80 hours a week. You don't get a lot of sleep. But I said, okay. And lo and behold, I had severe sleep apnea. Well, how severe was it? Well, first of all, my sleep was poor, right? So I was not getting but an hour and a half of deep sleep. And even in that hour and a half of deep sleep, you know how many times I stopped breathing per hour? Remember, I told you that 5 or more times per hour sleep apnea? I was like 60 something times per hour I would stop breathing. And when I got that result back, I was scared to go to sleep until I got my CPAP machine. CPAP machine cures sleep apnea if you sleep with it. And so the first night I slept with my CPAP, the next day I woke up, I felt like a new man. Where did all this energy come from? Why am I so much clearer in my mind? It was miraculous. And so I try not to sleep without my CPAP anymore. So maybe that's you. I don't know. Talk to your primary care provider. So we've been talking to you about sleep. We've been talking to you about potential causes for insomnia, some things you can do for that. And then we introduced the topic of sleep apnea. And we might in future episodes have to talk about this whole rigmarole about the CPAP machines being recalled and what are we doing about that, and you know, what's the fix? Are there other alternatives? So we may have to go down that route because, again, good sleep is important for you. It's important for your physical health. It's important to have a good normal weight, good blood pressure, good blood sugar, have good memory to avoid memory loss, to be more focused and be more productive. You need good sleep. So again, this has been another episode of the Prescription for Better Living podcast. I want you to, again, share the channel, share the video, like the video, comment on them. If you have questions, you got topics you want to discuss, you can email us, contact@rxforbetterliving.org. You can see it there on the screen. Contact@rx4betterliving.org, or you can just comment on the videos. You can DM us, whatever you want to do. But if this video has helped you, spread the news, stand on the mountaintop, shout it from everywhere. Hallelujah, Dr. Carter's here. Until next week, Dr. Carter out.